Welcome to the next segment of Team-Based Care Basics. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. In this segment, we will revisit all the steps and actions we identified throughout the series. This will show us how to start and complete the process of designing, implementing, and sustaining team-based care services. These are the steps we use to build our team-based care model. More information on how to perform each of these steps is included in the individual segments of this learning series. In our Designing the Team segment, we established our goals for team-based care and identified the performance measures to track our progress. These were our calls to action for the segment. Define goals and performance measures for a team-based care approach that fits our practice. Assess our practice and team to help decide our team-based care model. And define the future state we hope to achieve, what to keep, what to change, and what gaps exist. In the Establishing the Team segment, we focused on how to determine the composition of our team, assign roles and responsibilities for each team member, and begin to identify training and the clinical and administrative systems needed to support our model of team-based care. These were our calls to action for this segment. Assess our current staff and define new roles and responsibilities. Create and implement a people readiness plan to help prepare our team for the changes that are coming. Continue to build out our design. Decide what to include and what our team will need for training and support. In our Implementing Team-Based Care segment, we further defined our training and clinical and administrative systems needs and determined the communication structures and processes we will use. We finalized our implementation plan and began testing our team-based care design. The calls to action for this segment were: develop and implement our plan to establish team-based care services, create a psychologically safe environment to support our team, and establish the baseline data for our performance measures using the PDSA cycle to test our changes and adjust our design as needed. In our Sustaining Team-Based Care segment, we began tracking and monitoring our performance measures to determine if the changes we made had the effects we wanted. We identified revenue and cost-saving opportunities to help sustain our new model of care, and we reviewed how to use continuous quality improvement to improve the efficiency and effectiveness of our services. These were the calls to action from this segment. Identify revenue generation and cost-saving opportunities to help sustain team-based care. Establish a continuous improvement process to improve and advance the use of team-based care. And revisit our original goals and look for additional ways to expand our services. In our Working Beyond the Clinic segment, we identified ways to expand our team beyond the clinic and ways to help support our community and patient population. The calls to action for this segment include: research what social services are available in our community and build relationships with those organizations. Implement social determinants of health screening and patient navigation services to connect patients with services available in the community. And adopt an upstream approach, helping address health needs more proactively. If we are new to this topic or want a full overview of the clinical changes we might make to expand the use of our team, we can visit the Primary Care Team Guide for in-depth examples of team-based care models and case studies, or access the many other resources we have listed in the last segment of this series. To get started, we can choose one change to address a specific need. Even small changes can help move us toward a fuller vision of team-based care. To set up for success, we want to ensure that individuals and the organization are prepared for the change. Make sure our communication is clear and focused and that we communicate often. Ensure our team is equipped to perform their new roles and assignments, and that we continue to involve key stakeholders as we implement our changes. In the last segment of our learning series, we will wrap up this topic and provide information and links to the resources we use to develop this material. Thank you for joining us.